Welcome to In Good Shape. Here's what's coming up. Acupressure, how a traditional healing method can boost well-being and health. Nutcracker syndrome, diagnosing and treating a rare kidney condition. And heartburn, how risky are acid blockers and when is surgery indicated? Here's your host, Dr. Kerstin Lekutat.
So you want to go on a cool scooter tour or have a nice meal or a good night's sleep, but you can't because you're suffering from heartburn? Then you came to the right place for 3 reasons. First, this is the Helios Clinic Emil von Behring in Berlin. Second, I'm going to meet Dr. Mark Jansen. And third, this is In Good Shape.
Funktioniert sozusagen.
Wie soll ich das ausdrücken?
Original. Ja,
No one has to suffer from heartburn for a long time. We have great medications and surgical options with good long-term results.
It's nice to have gastric acid. It helps digest food, it fights bacteria, but too much gastric acid is not good because it can cause heartburn. There are medications against it, but recent studies suggest that they might be dangerous.
For 12 years, Peter Stöckl has been suffering from heartburn, also known as acid reflux. After eating, he often experiences acidic belching and a burning esophagus. He also suffers from an irregular heartbeat. It's all a source of stress.
Whenever I eat something, I'm just worried that it'll start back up. So I don't really have a big appetite anymore.
To reduce the symptoms, he started taking medication called proton pump inhibitors, or PPIs. They suppress stomach acid production by blocking a certain enzyme, but he soon found himself battling with side effects.
After a few days, I started feeling really unwell. I had diarrhea and stomachache. My digestion just wasn't working anymore.
These are common side effects, according to Dr. Christoph Funstein. Some of the people taking PPIs he sees don't really need them. In his opinion, stomach acid is part of a healthy digestive tract. It helps digest nutrients, and inhibiting its production should only be done if absolutely necessary.
For
this patient, I'd recommend taking the medication for 6 or maybe 8 weeks, then weaning himself off slowly, not stopping abruptly. And then we'll see how far the stomach has recovered, and the body as a whole. Maybe he wouldn't need any more medication.
The digestive side effects suffered by Peter Stöckl are not the only problems that PPIs might cause. Recent reports suggest that they could increase the risk of more serious conditions, like heart attacks or dementia. Dr. Wolfgang Schepp is an expert in the field. He thinks patients shouldn't worry about taking PPIs. He says the evidence against them is insufficient.
Taking proton pump inhibitors is very, very safe compared to all the other drugs used in medicine. There is some indication that there might be an issue. But there's no evidence that would make us withdraw the medication from patients who need it. That just wouldn't make any sense.
And some patients do desperately need it. Stephanie Bachmann suffered a painful narrowing of the esophagus. It had to be dilated, and since then she's had to take medication. If she doesn't, the stomach acid rises up through the esophagus and causes inflammation.
I prefer to relieve the inflammation with medication now, rather than to think maybe I'll get dementia in a few years' time, or whatever other side effects there are. That seems less important to me right now. What matters is that I have a cure now.
Studies have revealed one dangerous side effect: the risk of infection from Clostridium difficile, a bacterial species also known as C. diff. With reduced stomach acid, the microbe can spread more easily through the digestive tract.
If a patient comes to the clinic with Clostridium difficile colitis, which is a life-threatening diarrhea condition, that's an indication to check the proton pump inhibitor very thoroughly and, if possible, discontinue the medication.
Peter Stöckel stopped taking PPIs 2 months ago. He'd rather not expose himself to the risks.
If you're desperate, it does say on the package leaflet that you can take the tablets as a one-off. But it would be better if I didn't have to take them at all.
Stephanie Bachmann doesn't have that option. She'll probably have to take proton pump inhibitors for the rest of her life.
When I was a medical student, I had a surgical professor who told me those medications are medications from hell because they can make you impotent. And we doctors should stick to surgery. This is why I'm here in the operating room of the Helios Clinic Emil von Behring in Berlin, and I'm meeting the head of the department for surgery, Dr. Jansen. Thanks for having me today. How critical should we be concerning this medication?
We are facing a huge discussion about complications of these medication, like osteoporosis or kidney malfunction. However, the evidence is very low, and if the indication for these tablets is good, it can be given regularly.
Let's talk a little bit about heartburn. Why so many people suffer from it?
Heartburn is caused by the Western lifestyle. For example, obesity, smoking, drinking alcohol, or eating a huge amount in the evening.
And I know many patients who suffer from heartburn sometimes, and I think many of our viewers do suffer from it too. So when do you need to see a doctor? When is it dangerous?
It's not dangerous immediately. You don't need to go to the doctor directly. In most of the cases, it's probably enough to change your lifestyle, and sometimes it's also a good idea to take these kind of medicaments for a short period of time, like 14 days, for example.
Okay. And do you have to be concerned about, say, that there's a tumor developing out of this heartburn, like cancer?
The risk of developing a cancer due to heartburn is very low. It's approximately 4 out of 10,000 people. But if the mucosa of the esophagus changes its habits, like developing a so-called Barrett mucosa, the risk of developing cancer is much more higher. Therefore, you have to go to a doctor, have a gastroscopy. And in these cases, the risk of developing cancer is about 0.1% per year.
It's very low then. So it's totally safe to do some self-medications and to go for some over-the-counter drugs first?
Yes, it's possible to do self-medication. Be aware that you only take these medicaments for a short period of time.
What are the problems if you take it for a longer period of time?
If the indication is good and confirmed by a medical doctor, you can take these medicaments lifelong.
I had some patients who wanted to discontinue the medications and they had problems afterwards. So is it a problem to stop those medications?
It's not a problem. The gastric acid reoccurs and the esophagitis reoccurs. These patients benefit probably from an operation.
Speaking about surgery, when those medications don't help anymore, then a small intervention could be very helpful.
Uwe Hansen's doctor feeds an ultra-thin tube through his nose and down into his throat. Tiny sensors will determine whether his esophagus still functions properly when he swallows. It turns out that the muscle valve leading into the stomach has become slack.
My esophagus had suffered a lot of damage when I was sleeping on my back or standing. I'm a tiler by trade, which means working on my knees or sitting. I experienced severe heartburn and belching. It was really bad.
A team of experts at Germany's Johannes Wesling Clinic discuss what course of action to take. Until recently, gastroesophageal reflux disease had been underestimated and is even linked to a higher risk of cancer. A third of people in Europe and North America suffer from reflux. In many cases, prescribing a pill is not effective. Uwe Hansen's doctors recommended surgery. The aim is to implant a pacemaker that stimulates the muscle valve that closes the bottom of the esophagus.
The big advantage of this esophageal pacemaker is that the wires implanted in the muscles are extremely thin. It builds up an electrical field that exercises the muscle and makes it stronger. As a result, the food being digested can no longer rise upwards.
In the case of Nina Bergmeier, the doctors chose a new solution, placing a chain with magnetic beads around the esophagus. The chain reinforces the muscle valve in similar style to a rubber band, in the process restoring the valve's natural function. The surgery takes just 20 minutes.
What's changed for me is that I'm finally rid of heartburn after 25 years. It had always been a burden. I'd also developed a chronic cough and was constantly clearing my throat because of the feeling of pressure. Right after waking up post-surgery, I noticed that permanent feeling of constriction was completely gone, and I've had no heartburn since that day.
Nina Bergmeier can now indulge in a bit of coffee and cake, treats that used to be a major problem due to reflux. Minimally invasive solutions now offer patients genuine hope for the future.
So alternatives to medications is this esophageal pacemaker and the ring consisting of titanium beads. So what do you think of those interventions?
We should be careful in using this kind of new techniques because there is no evidence and no long-term results concerning these techniques.
But there are long-term results for other kinds of surgeries like this fundoplication. What do you think of this?
Yeah, this operation is the standard procedure in patients after having medical treatment. What we do is a laparoscopic procedure. This procedure has two steps. We are just removing the esophagus into the abdomen. We are closing the gap of the diaphragm, and we are placing application of the fundus of the stomach around the esophagus.
So you're taking the stomach and you're pulling it down and you're replacing it into the abdomen.
Yes, one cause of reflux esophagitis is hernia through the hiatus of the esophagus. And what we know is that the hiatus should be in the abdomen, which to reduce the risk of acid reflux.
So is this intervention only helpful in patients with hiatus hernia?
This is the primary indication for this kind of operation. However, some patients suffer from ongoing heartburn and large volume reflux. These patients can also be treated by operation.
Okay. And what are the results?
The results are good. What we see is that in ongoing studies we have primary success of 90%. So a recurrence of heartburn in only 10% in 10 years.
So if I don't want to take any medication and I don't want to go for surgery, is there anything I can do for prevention?
Yeah, prevent to get obese, don't smoke, drink only a few alcohol, and don't eat in the late evening.
But I do have some patients who are quite slim and they don't drink any alcohol at all, but they still do have heartburn.
Yeah, one additional cause for this problem is family history of heartburn. So also young patients without obesity can have this disease.
But what role does stress play in the development of heartburn?
Stress plays no main role in development of heartburn. The main cause is obesity and food intake.
Thanks for answering all my questions. Well, I don't know what you're doing. I'm still here in the operating room, but wait, I know what you're doing because you're watching this show. But after the show, you could take some time and send me all your questions.
On an upcoming show, we'll be looking at fascia, the connective tissue that encloses muscles and internal organs. Tight fascia can be a root cause of pain. So how can the problem be treated? If you have questions, send them to ingoodshape@dw.com. Write fascia in the subject line. We look forward to hearing from you.
What do you think? Give us 3,000 years. Do you think that surgery will still look the same like it does today? I doubt it. But on the other hand, there are some healing methods which are quite that old. Take Asian acupressure, for instance.
It looks like a back massage and feels like one.
It feels like a massage.
In terms of the hand techniques, it's a bit similar.
In fact, Stephanie Morandel is being treated with an ancient healing method, acupressure, in order to relieve her of a frustrating and debilitating problem.
I've been suffering from an extreme sleep disorder for quite a while, for 10 years at least. I needed a really long time to fall asleep, and I also woke up a lot.
She's been trying out acupressure for 2 months now. It includes a range of different techniques.
Pressing, massaging, pinching, stroking.
The aim is to stimulate over 350 points on the body, the same points used in acupuncture. According to traditional Chinese medicine, the body is crisscrossed with a network of invisible pathways called meridian lines, and these meridians serve as a channel through which vital energy or qi flows. If that flow is interrupted, the body reacts with symptoms.
You can place your index finger and middle finger on it, and you can feel a slight depression when you press down.
Stimulating the right point aims to loosen up the blockage causing the symptoms, enabling the qi to continue flowing.
Regardless of whether we press the point or insert a needle, the result is a local inflammatory process. That in turn increases the blood flow, which relieves the blockage, thanks to the body's own healing power.
Dr. Fromut Helmes says acupressure can help complement conventional medical treatments, although he doesn't believe it can replace them.
I see limits with acupressure and acupuncture where the underlying sickness has not been properly diagnosed. Patients should definitely have had diagnostic checks to rule out other more serious underlying illnesses. And then, if they are ruled out, these methods are appropriate.
Dr. Zhihang Zhang studied medicine in China and Germany. She sent Stephanie for blood tests and ultrasound scans to try to pinpoint the root of her sleep disorder, but the results were okay.
It might be connected to my kids. They used to keep me awake.
Mrs. Morandel is the type of person who tends to get worked up quickly, and she takes a lot of issues and stress on board. That's what I think the cause was.
In China, acupressure is used widely to treat all manner of symptoms. It can be applied at any time and anywhere, with a few exceptions.
In the case of an acute infection with fever, or if you have a skin disease or burns on your skin, then you can't use acupressure.
This patient has been suffering for years from a different problem.
I had recurring headaches and really bad migraines. There were lots of weekends where I had non-stop headaches from Friday to Sunday. They'd be gone in the week, but that happened often.
Natalie Heck decided to have acupuncture treatments to relieve her intense headaches. But because she would otherwise have to make the trip to the doctor every time, she was given the option of treating herself with acupressure. She can now stimulate the points on her own, whether at work or at home.
So how do I find the points? How do I recognize them?
Press down with your thumb and you'll feel a large depression.
Generally, each point is massaged for between 1 and 3 minutes, although very gently in the case of severe symptoms. For chronic symptoms, you can apply a little more pressure.
I did notice that things got better and that the intensity of the headaches has decreased. I can't say I don't get any headaches, but they have decreased.
It's definitely improved. I now sleep longer and deeper, and I fall asleep quicker. When I leave a session, I immediately feel that my condition is going to be really good that day.
Acupressure is helping patients around the world to alleviate pain and improve their well-being.
Oh, we humans are so proud of our erect gait, but it also has its disadvantages, like headache, stomachache, back pain, and even hemorrhoids. All this can be caused by a vessel which gets squashed by our erect posture. And this syndrome is called Nutcracker syndrome.
Nutcrackers as we know them, but there's also a health complication named after them, Nutcracker syndrome. But what is it exactly?
Something psychological? When a person is really closed and you want to make them open up?
I've heard of it before. I can't quite remember, but I've definitely come across it before.
I don't know what the syndrome is, but I do know what a nutcracker is.
Sabrina Inwich is a 26-year-old student. A few years ago, she developed a stomach ache, which kept getting worse. Sitting for any length of time was agony, and cycling became torturous. She suffers from endometriosis, a condition that causes the tissue that normally lines the uterus to grow outside it. So she presumed that was to blame.
At first I thought endometriosis must be the cause since it's a chronic illness, so I didn't think much of it. But after 3 years I went to my local endometriosis clinic and they realized that the problem must lie elsewhere.
The doctors found that the endometriosis couldn't be affecting the areas where Sabrina was experiencing pain. That made them suspect Nutcracker syndrome.
Nutcracker syndrome describes what happens when the renal vein coming from the left kidney becomes compressed by the superior mesenteric artery and the aorta.
It can affect both men and women. The condition stops blood flowing normally through the vein. This can lead to it flowing backwards into the pelvis via the ovarian or testicular vein. This disrupts circulation and can cause varicose veins. The exact cause isn't known.
Unfortunately, there are no typical symptoms of Nutcracker syndrome. Some women experience chronic pain. Some people find blood in their urine, which is called hematuria.
Nutcracker syndrome isn't especially well known within the medical community either. A gynecological exam won't reveal anything untoward, and only very experienced professionals can identify varicose veins in the pelvis.
We don't yet know how prevalent Nutcracker syndrome is. Our guess is that it's high because the symptoms aren't always obvious and doctors don't always think of it. It would be good if more medical personnel considered Nutcracker syndrome as a potential cause of chronic pain.
But varicose veins showing up on an ultrasound isn't enough for a diagnosis. An MRI scan enables doctors to identify the angle and positioning of the relevant veins and arteries. They also examine the blood flow for signs of renal compression. And these images reveal the presence and severity of any varicose veins in the pelvic area. In certain cases of Nutcracker syndrome, surgery is an option. It's generally performed by a radiologist. The patient is put under local anesthetic. The surgeon dilates the renal vein and inserts a stent, which keeps the vessel open. This kind of intervention isn't suitable for everyone.
The treatment is suitable for patients who meet certain criteria: chronic lower abdominal pain, a compressed renal nerve, and a backflow of blood identified on an MRI. The success rate is high. Patients are generally relieved of their symptoms within a few days.
After the stent is inserted, the patient needs to take blood thinners to prevent clotting in the stent. Sabrina had the operation a year and a half ago and will soon be able to stop taking medication. She no longer has any problems working out. For her, the minor surgery was a major success.
That's it for today. See you next week, and until then, let's all try to stay in good shape.